It sounds unbelievable and unrealistic that a hospital in Napak district, Karamoja sub-region, can treat COVID-19 at 50,000 Ugandan shillings only. The patients are fed every day by the hospital, and they are also put on oxygen just like any other part of the country. Matany Hospital in Karamoja's Napak district is a center of excellence, a private not-for-profit hospital owned by the Moroto Catholic Diocese.
The Matany Hospital has been around for over 50 years now, and over the years it has been providing a highly subsidized service to our people, since we know that we are serving the most vulnerable people in the country. So now, when COVID came last year, so it got us when we are already having this particular principle of offering care at a highly subsidized cost.
This building, formerly a TB ward, has been dedicated as a treatment center for COVID-19. It looks simple compared to hospital facilities in Kampala, making unreasonable charges to treat COVID-19 patients, but it is standard and has basic requirements of treating acute and mild COVID-19 cases.
In the COVID treatment unit, we have treated 107 patients, and we have admitted actually 87 patients. 30 are on home care, but all these 87 patients, some of them deserve oxygen. So it is this that really has led to increased consumption of oxygen. And then the other is the cost of treatment of a COVID patient in Matany Hospital is only 50,000. But all of this is because some of the inputs which are required which would have taken a lot of money, have already been part of the hospital. And here I'm talking about oxygen, because this is one of the major drivers of the costs up, which yet for us here we already had our oxygen plant.
However, according to the doctors, the cost of treating COVID-19 varies on its severeness, and at Matany Hospital, they are so far treating mild cases. Some of the caretakers of COVID-19 patients at the unit confirmed the cheap cost of treating COVID at Matany Hospital.
We are on admission, or when they bring the person to the ward, you pay 50,000, and then as the person is still owned, but we've not yet gotten the whole bill, but it can't even be more than 100,000.
The Parliamentary Committee on COVID-19 on an oversight visit in Karamoja, headed by Dr. Charles Ayume, wants government to increase its support to the hospital and learn from it.
What we should do for this hospital, we should increase the PHC grant that comes straight from the Ministry of Health, because this hospital is serving Ugandans. Funding for this hospital to maintain its running is key, because as you see now, they are heavily relying on donor aid grants, which are unreliable. Anytime the donor pulls out, we will come here to bury this hospital, to liquidate it.
We came here expecting to find a bit of poor indicators, but we have been a bit surprised that staff are really well motivated. This is a hard-to-reach area. It's quite far. Some of the districts are new. They do not have even a health center for. What has been promoted from a health center 3 to health center 4 is really lacking in infrastructure, in human resource. So I think the onus is upon government to expeditiously come forward, not only for Karamoja, but for the rest of the country. We have just been slowed down by COVID.
Some of the legislators have commended the hospital for supporting the communities in health care services.
As members of parliament, one of the key things that we really see, because we've noticed that they're doing so much with very little support that is coming in from the country itself, from the government itself. So we see that there is a need for government to intensify the level of support that they provide into this facility. But we also see that this facility is actually operating like a regional referral hospital. It is not just receiving patients from Karamoja. There are patients coming from Teso, from Bugisu, from West Nile, from northern Karamoja. It is actually having a catchment area that is not different from any regional referral hospital here.
Philip Aguta, UBC News in Napak District.